This video is designed to show students how to record their case logs and document their patient interactions on EValue. So a patient interaction is defined as a physical encounter the student has with a patient that occurs during an assigned clinical experience and involves any of the following: evaluation and diagnosis of the patient, treatment and management of an injury, illness, or condition, application of therapeutic interventions, supervision and or implementation of therapeutic exercise, administration of diagnostic testing, communication with the patient about their status, plan of care that may or may not involve the physician, other healthcare professionals, family, caretaker, or other people. And finally, application, supervision, and or implementation of various methods to reduce the risk of injury. So if you look at this, if a student is evaluating, diagnosing, treating, communicating, implementing, or overseeing some type of rehabilitation, they're more than likely going to go ahead and document that patient interaction. In addition, if they're providing some treatment related to acute care or general medical, they'll go ahead and document that as a patient interaction. So now that we kind of have an understanding of what a patient interaction is, we can look and see how to log that on EValue. So when you log into EValue, this will be your home screen. There's two ways to log a case or a patient interaction. You can click on this tab, Log New Case, or you can go up to Case Logs. So we'll click here. To log a new case, you'll select the date, the activity, which is the course that's linked to the clinical experience. The site will be your clinical site. The age will be the age of the patient. So we've grouped those into 4 categories: pediatrics, adolescents, adult, or geriatrics. And that's a KD requirement. You'll select your supervisor or your preceptor. If you want, you can put the time with the patient. We're not requiring it, but if you want to document that, you can. We'll say that we spent 30 minutes with that patient. Functional abilities is kind of the level of competition. So was it a competitive sport, a non-sport activity, or recreational? So competitive would be high school athletics, recreational would be at their own leisure, and then non-sport would be something where it's not related to sports, maybe something that you might see in a clinic. So you'll identify that. You'll select the gender of the patient, so female, male, or other. You'll select the body part. So for this, we'll say it was their foot or ankle. And then you have those questions that are linked to the core competencies in the KD standards. So we have, I implemented patient-centered care during this interaction. I implemented interprofessional collaboration during this interaction. I implemented evidence-based practice. I implemented quality improvement, and I implemented healthcare informatics. These terms will be explained to the student throughout their time in the curriculum at Wayne State University. So as they are exposed to that, you will be expected to go ahead and document that. If for some reason you are unaware because you have not yet been exposed to that terminology and you are unsure, then you will simply collect or select NA. So for the first 3, you're required to document something. And for the last 2, you're not. But those terms and those things will be explained to you throughout your time at Wayne State. And as those unfold, then you will start to document those. Then you will go down and you will select the procedures that you did or worked with the patient. The procedures are grouped into various groups. So we have communication, diagnostic testing, evaluations, injury treatment management, prevention risk reduction, therapeutic interventions, and therapeutic exercise. So if you want, you can use these groups to kind of click down to specific procedure codes if you know what you're looking for. But if not, you can keep all groups selected and then all of them will be listed. So let's say, for example, you had a patient that came in and maybe they sprained their ankle. So you performed an evaluation on them. So we could go to evaluations. You would select evaluation of foot and ankle. Once you've selected your procedure code, you'll then select your role. So there's 3 roles, and this is very, very important. Your first role is observed. So that would be you observing your preceptor performing an evaluation on a foot or ankle. Assisted means that you and your preceptor work together to perform that evaluation. Performed means you did it solely alone by yourself without assistance. Maybe you talked to your preceptor about it afterwards, but you were doing the evaluation on your own. So you will select the role. So we'll say, for example, for this, maybe you assisted, you and your preceptor worked together. You can even put a little note if you want to, and then you click Add Procedure. But maybe you did more than that. You didn't just evaluate them. Maybe you evaluated them. You also fit them for some crutches, and we'll say that you did that alone. You and your preceptor did the evaluation together, but then you were able to fit them for your crutches alone. You would add that procedure. And we'll say that maybe you even did some, you gave them an ice bag or you put some type of cryotherapy on them. And we'll say that you did that alone too. So as you can see, I can add multiple procedures to one patient interaction. When you've loaded all of your procedures related to that patient interaction, you'll click Save and Record, and then that will go ahead and be documented. You can go to your reports, and you can go ahead and look at case logs by student. Or you can go back to your case logs and you can simply look at the things that you submitted there, and you can delete, edit, review them, and things related to that. And that is how you document a patient interaction or report a case log on EValue.